Hi, Dr. Katrice Brooks. I'm so excited to have you as a guest today on the Genetic Genius podcast. Welcome.
Thank you so much, Dr. Lily. I'm so excited to be here.
Yay. Well, before we really dive deep into our conversation today, I'd love for you to just take a moment to, introduce yourself, talk about your passions and who you are so we can get to know you a little bit better.
Sure, I'm happy to. So I'm Dr. Katrice Brooks. I've been practicing family medicine for the past 9 years now out of residency. I live in Milwaukee, Wisconsin. I'm originally from Chicago, Illinois. This is all over the place. I went to undergrad at Spelman College, and then I came back home for med school. When I was in med school, I liked most of the specialties, and so I thought family medicine was a good fit. It's been going great so far, but the pandemic was rough on me, like most other people.
Right.
And so I ended up resigning of my job of 8 years. It was my first gig out of med school, and it went well for the most part. But during that time, I just realized that I wasn't really living the life that I wanted to live, and I wasn't happy. Sorry, and I've always advised my patients to leave, and so I left and started my own practice. It's a direct primary care clinic, so it's a membership-based clinic. I started my own practice, and now I do freelance doctor work as well, like locums gigs, and I'm now in North Carolina visiting a friend. So life has changed dramatically, and I now feel in charge of my own life. So I'm super excited. I want to spread the word and the message. I also skipped over some of my training and my interests, but it's just so much. Like it's just so much to talk about. But that's the overall big view of me.
Right. That sounds great. And you're not the only one when it comes to health practitioners. There's been such a change in the way that we work and view and help our patients since the pandemic started. And I think that it's all rolling out for the best. I think we're realizing that we can be a lot more mobile in the way that we help patients, which is great. You don't have to necessarily see them face to face if not needed. They can be in their PJs. And so can we.
And so can we, right? The whole world realized like, hey, the way that we're doing things, we don't have to do it that way. There's something else out there, and everyone thought what we were doing. And so
right.
It's been great so far.
Yeah, good. I'm excited to learn a little bit more about you and your practice as we dive in. So today we're really going to be talking about some of your faves. So how habits can transform health, which one of my favorite topics. And then also how to follow your passion. I think you're going to have your own story there. And then also we're going to be talking about how you can support yourself and others during a health crisis. And I think we have seen the pandemic, but I'd love for us to dive deep into talking about more from that chronic disease state and what that looks like. Let's start first with like healthy habits, because I think that's a great place to start. So why are these so important for transforming a listener's current state of health? Why should we have great habits, and how can that even help us?
Because the truth is, it starts with habits. Like you can not have the habits and kind of end up where you are or where you are not deliberately trying to go, or you can set an intention and then habits that directly are linked to that and end up in places. And so the way that I got super interested in habits was as a primary care doctor. I would give people these recommendations like, oh, you should exercise and get 150 minutes a week, and you should eat 5 servings of fruits and vegetables a day, and you should not smoke. And I could tell them all the things, but they would come back not changed. It would be like, what happened, right? Like, how can we? And so the question was, how do I go from getting patients the information of what I think would serve them best and how they would have the best health outcomes, and the actual transformation in doing? And when they were in my office, we were all on board, but when you leave, you have to do it. And so I learned that I really need to start coaching my patients, or just getting them to the end point rather than just telling them what to do. I could tell them what to do, and some people it clicks. Some people you may not need habits. You may already have these habits ingrained, maybe by parenting, or you have just figured it out for yourself, and you are able to get yourself to do certain things in certain ways and do it with prompting, maybe for some people. But most people don't work that way, and most people, we actually do have habits, and you may just not realize that you have these prompts that get the action that that's the desired activity. But our whole life is really habits, from when we wake up and go to the bathroom and brush our teeth and get ready for work. It's all little pre-planned activities that we do constantly. And so knowing and hacking these habits allows you to really transform and take care, or get to the goal that you want to get to. And so now you're able to plan and say, okay, this is the desired result. I want this goal.
Mm,
All right, let me think of these little things that'll get me there. And habits are compound interest. It's the compound interest of life, right? It's the little
right.
stuff that we do, the little tweaks that we do that we're focused on, that you look up and it's gained all of this traction and momentum. And
Mm,
so I'm obsessed with habits because I personally struggle with them. I personally
mhm,
struggle with, I have days I just don't want to do anything and I just want a no structured sort of day. And habit
mhm,
isn't necessarily structure, it's just having this set routine.
mhm.
Um, and because I've always struggled with it and just been interested in it, I just see the power of habits so much. So habits are everywhere. And good habits
Mhm.
will set you up for success. And bad habits, even though you don't realize them, they're there. You have those prompts and you do the bad habit like clockwork. They're there and they set you up for things that you're not wanting, the results that you don't. Everything comes back down to habits. Like you can boil down most things to habits because it
Mhm.
is.
Yeah, that's so true, Dr. Brooks. And I really like what you said too about when a patient comes into our office, it's or whether we're seeing them on a telemedicine visit, either one.
Yeah,
But when we give them a list of things to do, it's how is the compliance going to be, right? Is it going to be
absolutely.
100%, 75%, 50 and zero? And so meeting them in a way that allows them to create that new habit set point is so important. So what do you think are
Yeah.
those like top three like most difficult areas to make a habit change and then help it stick?
Ooh. Ooh, that's a good one. That's a good, because like there's like the habits that we know that have impact, like the efficient habits, but ones that are difficult. I would say stopping habits are difficult because
Mm,
habits are born in environments. And so if you have the environment and the same prompts, it's going to be very hard not to do that automatic programming. Like habits are like a little computer program. You type in something and it will spit it out. Like your brain and the environment, the prompt, you have a prompt, a cue, a trigger, and then the action, and you're going to get that and the reward.
mhm. Right.
So
The
I
reward
would
is
say
good.
the reward, exactly. I would say quitting is difficult. That's why it's hard to quit smoking. And that's why it's hard
Mhm.
to quit doing vices because you keep getting those prompts. So if you haven't eliminated and that's like when people come in telling me that they have a hard time quitting smoking, I understand smoking helps you take a break, it helps you breathe. We have to acknowledge what the habit gives us because it is giving us something. Like there's a reason why we keep doing it. The reward keeps being there. So you have to acknowledge that even bad things, which they're not, but
Right.
um, smoking is bad. I'm not saying that, but not good or bad. I'm not judging it. But even things that we don't want to do, they do benefit us in some ways, and that's
Mhm.
why we keep the habit going. And so I would say changing habits that you don't want are hard, and
Mhm.
also doing something you don't want to do is a recipe for failure. So
Right.
the idioms of habits is like help people do what they want to do, and if people are doing stuff that they don't want to do or you're trying to create a habit you don't want, you won't. And so it's really figuring out the why or really what is the real habit that you really want to do because eventually your motivation will wane. And
Mhm.
there's a habit loop, which is the prompt, the trigger, the action, and the reward. But then there's BJ Fogg's model of habit behaviors. He wrote like
Mhm.
Tiny Habits, and his idea is that behavior equals motivation, ability, and prompt. And so if we have things that we don't have motivation to do, you're not going to do it, right? Like
Right.
if you never want to do it, even if you have the right prompt and you are able to do it, unless the ability, unless it's very easy, it's going to be hard to do. So usually changing one of those variables in that equation, I would say the hardest is probably motivation, creating
Mhm.
something that you really don't want to do. The
Right.
buy-in, that's the biggest thing is you have to be convinced that it's something for you and that you want to do it.
It's all about mindset, right? So you have to
All about
really want it and desire it to make it happen. Just if your friend says, "Hey, why don't you run this marathon with me?" You're like,
yeah,
I don't know. Okay. And then
right,
you're like, you have to train all the
right.
time and do it. And then you're like, I really didn't want to do this. And then usually something happens so you can back out, right? You're like, oh
Absolutely, right.
yeah.
Yeah,
You
for
hurt
sure.
yourself or something because you didn't really want to do it. I think that's a really important key piece that you said, Dr. Brooks, about really, if you want to change something, you have to really want it. Otherwise, if from the physician standpoint, if we want to help you change, you have
Yeah,
to meet us somewhere in the middle. But without that motivation on the patient side, it never really happens. It's like something, like you said, you can start it and it's like a hiccup over and over again.
Over and over again. And then we're in the clinic. We've talked for the last year about things to lower your blood pressure, exercising and diet to lower it so you can get off medication. You have to really not want to be on medicine, or you have to really want that true outcome that you're saying, which is fine. Like, it's also, you have to do some self observation to see why do you want that, or why do you think you want it? Because maybe you don't. Like, when you look at it, sometimes when we're talking about losing weight and we say, oh, we want to be healthy, etc., that's probably not it. Like, maybe it really is to look good in your clothes and to go back to your 20th reunion and to have everyone say you look so amazing. And that's okay.
Right.
Like,
That's a great
there's
motivator.
nothing wrong with that. Exactly.
Yeah.
Right. So being honest with that, and finding the why, and also reinforcing the why. That's all. Like, when you have a hard time sticking with habits, you need to troubleshoot them and go back to the why and just continue to troubleshoot each of those pieces until you get the desired result. But often motivation is a hard one, because it's hard to fake motivation. It's hard to
right.
create a false motivation.
Yeah, it's not like there's a pill for motivation. It comes from within.
It's not.
Yeah,
it's not. And the rest of them, like ability, you can make it easier, you can make it harder to do, but the inner motivation it's either is or it isn't.
Mm-hmm.
But I guess that's not true. I think sometimes we can get more motivated by learning more about things. Like,
that's true.
With the example of running a marathon, if you then make that your personality and, oh, I'm into running and I want to do this, you can not false, but create some motivation. But again, that's your own mind saying, okay, I'm interested in this now.
Right. Yeah. And you might learn to love it. You know, like in the beginning, you're like, I might not really like exercising. You're trying to help a patient with exercise, or if you're listening, you're like, I really want to start exercising. And I think another thing too is really finding, if you're trying to make a new habit, and I think you were talking about this, Dr. Brooks, look for something that helps motivate you, but something that you love. Like with exercise, there's so many different types of exercise. So what did you do when you were a kid? Like, did you roller skate, or like play tennis or whatever? And so then do that. And then you will love that, hopefully, and then do some other forms of it.
I love that. That is so true. I am always suggesting, what do you like to do? What's fun to you? And I said, what did you like to do as a kid? What is play for you? Because then it's so much easier. You already have that natural motivation. You already baked that into it. That's so awesome.
Yeah, that's a super good one. Yeah. So when someone that you're working with, a patient, for instance, or our listeners out there, they want to create a new habit. Okay. So they like have this new goal. And what do you think is the main trigger that they keep falling back into that old routine? And then how do you get out of that pattern? So you have the motivator and you're like, okay, yeah, I really want to do this new habit, but then you keep falling back. You like have a setback.
Yeah, that's a good question. Evaluating again the anatomy. So maybe the prompt is not so good. Maybe you don't do the habit because you forget about it. If the habit is to exercise and you forget until the end of the day, and at this point now your motivation is lower, you're not going to do it. So I would make the prompt really big and make it obvious. So if you are struggling with habits, make it obvious and don't make the habit big. That's another thing. You want to make the habit as small as possible so that you're successful. Right. So as humans, as people, we like to do things. We like to hear good job. Like, it makes us keep going. Like, we want to do more of it. We change by feeling good, not by feeling bad. That's another kind of BJ Fogg thing. So the more that we do things and we're good at it, people are saying, oh, you're good. You're doing good. The more we want to do it. And with prompts, again, you want to make it really obvious. If you keep forgetting, if every day you forget to do it, you need a new prompt. That prompt is not working. Right now, your alarm, you want to wake up early. That's like the alarm goes off, but that prompt is there. The alarm is there, but you ignore it. So maybe you need something else that is going to be a better prompt for you if you ignore that. So it is figuring out when this happens, when the whole habit loop happens, when the trigger happens, what do I do? What is the trigger? Do I know what the trigger is? The trigger too vague? I'm constantly working on little habits and tweaks in my life. I'm working on a habit to warm my car. It's a really random thing, but it increases my quality of life. But my trigger is when I leave the house or when I get ready to leave. What does that mean? Does that mean when my coat is on? Does that mean when my shoes are on? Does that mean when the key is in the door? And by not having a very specific trigger, the habit needs to be very specific. And there's a habit formula. After this occurs, after A, then I will B. That is the habit formula, right? Yeah. So you have to have a very clear after action. It can't be, if it's clear for you, when I leave the house, I really mean when I put on my shoes and coat, but that can mean when you wake up and you start getting dressed. So sometimes the prompt is not specific enough. And you need to make it more specific so you can't miss it. So you can say, all right, again, when at this exact time, what happened and how did I respond to the prompt? Did I do it or not do it? Did I ignore it? Did I even see it? Is it obvious that I know?
That's great. I love that because I think it's really important to have the A to the B and the simplicity. And I think, like you
Yes,
said, about if it's too big of a habit change, we just feel
yeah,
overwhelmed or F
we
that.
do.
Like I'll
We
never do
do.
it. So I might as well just
Never.
not do it. Right. Yeah.
Absolutely. So you want to
Mhm.
make habits as small as possible so that in the worst of times too, you can do the seed of that habit and still feel good about it, because life
Right.
happens and you're not going to do your habit perfectly every day. It just,
Right.
we don't. Even stuff that we do every day, sometimes we forget to do it. Sometimes it's, oh, I forgot to put on deodorant, or not that, but it's like things that you usually have on autopilot, these habits that
Right.
you
Like brushing your teeth
always
or
do.
something.
Exactly. Brushing your
Yeah.
teeth, things that you always do. Sometimes something may happen in the middle of that and it's like, I didn't do that. So you're going to
Right.
have days where you fail, but what is the smallest kernel that you can do so that you can always do that little habit loop? So your
Hmm.
brain wires in that little habit loop. So the
Right.
smallest kernel of that for exercising, that's a really big one. Maybe your exercise trigger or prompt is when I get ready to exercise, I put on my shoes,
Hmm.
or after I get home from, or when I wake up in the morning and have my cup of coffee, I put on my shoes.
Right.
Even if you don't have time to exercise, doing that same habit loop of putting on your shoes is going to help your brain latch onto, this is what we do. This is the exercise, or the habit of exercising, and we're going to make space for it. So
Hmm.
you're going to eventually drink your coffee and put on your shoes without thinking about it. That is the
Right.
goal. It's that we
Right.
put all this stuff on autopilot so we don't have to work so hard. And again, we then gain the compound interest of doing all these things that we had the intention of doing. And that's
Right.
the beauty of habits.
Do you think that your body gets bored of the same habits if you don't have mix it up?
Well, I think humans, we love routine. So no, I think your brain might crave novelty, but I don't think
Mhm.
that the novelty has to be in your habits, right? It could just be in
Right.
other things, right?
Yeah.
Like you can have your routine and then maybe even build in novelty. But no, I think our brains like novelty, like not, it likes routine, right? If I don't do things in this way, then it's a mess.
Right.
So
Yes. Structure. I think structure sounds like
structure,
it's
right?
key. Yeah.
Structure.
Yeah. That's
Yeah.
great.
I
Yeah.
know
Mhm.
it's some people are anti-structure, but there are certain things that I do need to be structured. And if it's
Right.
not, it doesn't work for me. And that I had to learn this through trial and error. Like in order to
Hmm.
make my life work, I had to make certain things habits and like
Right.
non-negotiable.
Yeah, that's true. I think, yeah, you want to have those non-negotiables where you're like, okay, this is,
Yeah.
I have to eat 3 times a day. Like that's
Right.
non-negotiable.
Right.
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 So that's a
Right.
good structure,
Right.
eating healthy
For sure.
foods. But then you can also have, oh, I'm going to go out to tea with my friend, mix it up and have a little
Exactly.
treat or something. So that can be like the free form.
Eating is a good one. Yeah, when you eat, maybe you can have variety of what you're eating, the plants and
Right.
etc. But
Hmm.
yeah, and humans, we crave novelty. Like I said, we crave new things, but we also crave structure. Like we like safety of structure, but
Right.
we're always scanning the horizon for something new and
That's
different.
right. Yes,
Right.
that's what makes us unique.
Yeah, exactly.
Yeah. So let's switch gears and talk about, I know you really love, your passion is really helping women find their passion and purpose. And can you talk a little bit about this? Like what was that for you in your own journey? How do you help your patients and community with that particular aspect?
Sure, I would love to. So I've always felt like the way that I'm doctoring is always kind of helping people with habits, but really helping people figure out their goals and what they really want to do, what's in their heart, and getting to that. And so, counseling people over all the years doing that, eventually I realized that I was waking up and really miserable. And then it was like, but why? Like, I would go to work and I enjoy the work that I did, but I was very tired. And so I realized I did a lot of soul searching. My passion is really in helping people and seeing them through things. For me, it was like the volume that was the soul crushing thing, corporate
Yeah.
medicine.
Yeah.
Um, and it was really stepping out on faith and just believing in myself that in the
Right.
same way that I counsel people, if there is something that, as a physician, if something hurts, don't do it, right? Like stop,
Right. Yeah.
right? So with in our lives as well, if we are living lives that we don't love and that we're not passionate about, then we should stop doing that. We should
Hmm.
stop the routine of that and say and change it and somehow and make small changes along the way. So
Hmm.
initially with me, when I realized I wasn't loving medicine, I got trained in lifestyle medicine because it was like, I don't like being a pill pusher. I don't want to do that. And I really want to help people, and I want to help them with these habits to get to where they want to go. Um, and then I realized that wasn't it either. And I tried to do it for 2 years, right? I tried to do group visits and count. I was able to do it in a one-on-one way, but corporate medicine is 15-minute visits and
15
20
minutes. It's just that there's not
it's
enough.
very
You
difficult.
can barely
It's
like get to
very
know them in
difficult.
15 minutes
You
and find out
can't.
what they really need.
It is extremely difficult. I hate that we practice medicine this way. Like, then you think maybe it's a bunch of visits added up. Like, maybe I really saw them 2 hours over 8 years, but it
Right.
is very hard to do it. And so that was like, that's not working. And again, I tell people all the time to leave their job. I tell people all the time, and if it's not serving you, leave it behind and find what serves you, and keep looking and trying until you really find what's serving you and that's making your heart sing and that you are passionate and happy to do every day, and that
Right.
you don't feel as a chore. And I wanted to live that, and I am living, like, after I left my job, I am completely living it now. Life feels amazing, and like I'm not working every day. And I want to share that. I don't want to say we can sell this lie. That's not true. But for so long we have thought life had to be a certain way, and you have to be a certain way, and
Right.
you went to college, so you have to do the job that you signed up to do, or that your friends, they say you're the doctor, so you have to be, like, all of this stuff, these roles that we've created for ourselves. And it's really about living authentically and following the passion in your heart, and really doing what I don't say you want to do, but what speaks to you, what you're creating the life that you want to live, and developing that, and making that your art, right? Making your life your art and developing that. So I'm very passionate about that. So the way that I share it with others is I share it with my patients. I don't do official coaching, but I feel like the type of medicine that I practice is really type of life coaching as well. I share this on the podcast and when I talk to people in interviews. So that's the work that I'm doing, and I'm still figuring it out too. I'm relatively young. I look younger than I am, but I'm in my late 30s, and I'm still figuring out, like, what is my true passion. Let me follow that every day. Let me spend the majority of my time working at my highest level, and of my passion.
I love that, Dr. Brooks. And I think it's so true what you said too, when we have created, like you said, it's not like somebody told us exactly, but there's certain frameworks that have been created. If you do this, and this is the path. And I think the pandemic, that was one great thing about the pandemic.
It was a disruptor.
It blew up all of those ideas.
Definitely.
Because people had to create a different lifestyle for themselves and look more deeply at what they're doing in their life. And is it fulfilling? I had a huge practice with 18 practitioners. I had to close it. And now it's just me, and I love it. I'm like, I don't have to, right? Yeah. I don't have to be the manager. Yeah. I can, do it if I want to not work, which I could before, but I felt like I had to, right? And now I'm like, no, like this week, I'm like, I'm not working today on Monday. I took the day off and I just relaxed, and it was like, oh, this is nice,
It is, right?
Yeah, right.
Yeah. And to be in charge of that and to decide for yourself. For sure. Sure.
Do you think that the role of women, so it's interesting when we think about we're the providers, or not the providers, we're the supporters, the healthcare that love action. And we had this whole women's right movement where we can do any job. And I think that is so amazing. But at the same time, I think that a little bit, it created this, like, we have to work as hard as we can and prove that we can do that. And we don't need to prove it to anybody. We're amazing women just as we are. And we can work for 1 hour or 1,000 hours.
Absolutely. And we're worthy all the time. We don't work at all. That's an okay choice too.
Yeah.
Again, it's the authentic and the passion, right? What you really want to do and what you're called to do and what you love doing, the life that create the life that you love. And you're right. I think especially as girls, it was like, oh, you got to go to school. Don't forget about those boys and just be good. Get your education. At least as a Black woman, we're definitely told, get your education. Don't worry about family, kids, or anything. And that's a lie.
You're like, wait a minute.
Right. I had this realization, and this was when my mom was in hospice 4 years ago, but it was like, why am I working? I'm working for family. I'm working so that I can provide and take care of my family. That is the goal, is the connection with the family. It's self-fulfillment, right? Like career is a part of the self-fulfillment. So I'm not saying that. And I actually don't have any of my own born children. So I'm not saying it's only family, but it's the people in your life and it's connection. And we work to have that connection. If we forget about that completely, then who are we at the end of our lives? Who's going to be there for us if we ignore all of that for work? So it's really about a work-life balance. And for me, a big part of that is not work, right? Because that's really my career is my life as well. And I'm trying to integrate them so that they are literally one, so that my career and my family and my passion are literally the same thing. They're indistinguishable. It's not a work-life balance. There needs to be balance. We work to be with our loved ones, to have free time to spend with our loved ones and to
Right.
be there for them. And no amount of money or prestige or accolades is really going to give us the love that family and other humans and colleagues and friends, and not just family. Like, I'm here visiting my best friend. I'm so thankful that I
Mm,
left my career, or not my career, but my employment. And now
right.
I have what's the word? But I have ownership of my time so that
Right.
I'm
Freedom.
able to take
Hmm.
off freedom. That's what it was.
Hmm.
And I'm able to take off 2 weeks and be here with my friend, or a week.
Right.
And so important. And I'm so thankful that I've created this for myself. And pre-pandemic, I wouldn't have done it. And my friend, she's another female entrepreneur position. And so she led the way for me. But
Mm.
that is why we work. We work for that.
Yeah. Dr. Brooks, let's shift our conversation over to chronic disease and how we can, why it's so important to have the support, not only for ourselves when we're in that chronic disease state, but also what support we can provide for others. So I'd love for us to talk about women in general, because I'd love your thoughts about why women are having so much more chronic disease, especially autoimmune diseases, diagnosed so much earlier, and what that is doing to like the outcome of their thought process, their views on health, and how they're needing to shift their support.
Awesome. So there's a couple things in that question. Yeah, women are being diagnosed earlier and more often with autoimmune conditions. On one hand, I think that's good because I think at least they're getting diagnosed earlier and sooner.
Mhm.
Is there more incidence of it, or is it more actual diagnosis, and supporting people throughout the diagnosis of chronic diseases? And that's super important. So I think step one with supporting people with any chronic disease is one, acceptance, right? And
Mhm.
not blaming the person or the patient, because often we get a new diagnosis. Oh, what did you do? What are you going to change? Which is, a lot of things can be lifestyle contributed, but it serves no purpose. Blaming me for what I'm going through, help me. How does that
Right.
provide help me to be any better?
Mhm.
Rather, me now I feel a position of powerlessness, and I feel that I'm somehow trapped or not involved in this, rather than
Mhm.
empowered with the
Mhm.
diagnosis. So step one is not blaming the person. Often when people get a new diagnosis of cancer, it's, did you eat bad? Or often diabetes, how much sugar were you doing? And
Right.
diabetes has like a genetic component, and
Yeah.
so many other things. And autoimmune diseases, also, there's a lot that's unknown about them, but there's the thought that maybe trauma and environment and all sorts
Mhm.
of things play a role in those things, right?
Right.
And on one hand, it is good, like it is helpful to understand what environmentally that we're doing that contribute to it so that we can change it. But the people on the outside doing that to us is not helpful, and it just
No.
really creates distance and space, and often we do that. Next is to, in addition to not blaming them, is to just holding space, because a
Mm.
chronic diagnosis is life changing.
Mhm.
Often, unfortunately, we become that diagnosis, or instead of saying, I'm a person who has diabetes, you're diabetic, or,
Right.
you are, I'm trying to think of some autoimmune ones. You have hypothyroid, although we say that one is different, but they take on that personhood of the disease rather than just a person who has it. And so it's really holding space that they have gone through something major and life shifting, that their
Mhm.
life before this diagnosis and their life after is now different. I
Mhm.
won't say that they are different people, but their experience has changed them. So they are essentially different. And it's holding space and accepting that person now that is different, and that life may look different and may have to do different things. And it's being there for that person and showing them that you're going to be there for them regardless. That's so important. It's just like holding space and
Mhm.
going through the dark with people. That's something like with Brene Brown, the authenticity, but just holding space and really being there for people, because that is
Right.
what facilitates healing and community, and connection. So that the radical acceptance, that's what the radical acceptance, non-judgment. And then I think being forward thinking, and I guess positive is not, we know like positive psychology, and even with like placebo drugs, the way the slant that we put on drugs and how we think of the mindset, that's what you called it earlier, but
Mhm.
helping them with a positive mindset. So
Mhm.
not being falsely positive, but also not being unduly negative or
Mhm.
very critical. And I just try to stay educationally positive. That's not the word. That's not the word I really use. Research positive, right? Like I try to focus on the things that I know, but that will benefit me, like the positive things about the things that I know, or that I have power to change.
Mhm.
So if you have a new diagnosis, if you know that you have power to change your activity, focusing on positive change with activity and movement. If we know that we have power to change our diet and what we're doing, focusing on positive changes with those things. And again, also not commenting on the negative stuff, right? So somebody's diabetic, not like, why are you eating that? Instead, we change by feeling good, not by feeling bad. So instead, encouraging people when they're eating great, making great choices. Oh, I like how you made that choice and good job with what you're doing. So motivating people with kind words and kind actions rather than beating them down, because people who beat us down, we just will avoid. We're not going to talk to them or tell them all that we need to heal and grow.
Yeah, that's so important, Dr. Brooks. And that there's a piece in there too that I want to step back to. When someone is in that diagnosis like phase, what are your thoughts about, just the labeling in general? I sometimes feel that I wish that we didn't even have the label of a disease, because I think it just changes everyone's everything about it. And some people, they can just be like, oh, that doesn't matter. That, but then other people, like you said, they become that. And then also if someone's in that autoimmune state or chronic disease state, that becomes their life and they can't get out of it. It's like the bad dream almost.
I agree. I hate labeling too, or the quest so much for a diagnosis, because one, what does the diagnosis do? I guess it gives you insight into what it is in the pathophysiology,
right?
But really, we want to just feel better. That's the goal, is always to just feel better. So then what can we do to get you feeling better? Let's focus on that instead of all the, not intricacies of the disease, but I know people who become, like you said, obsessed with it. And so they're obsessed with symptoms that they don't have. They're obsessed with any little thing, is this, that. And if you know what, maybe it is, but okay, so we got that. What is the next step? How do we get you better? Because that's really, we want to get transformed and healed and feel better. We all just want to feel better. We all just want to feel good. And sometimes diagnoses give you power, right? A little bit.
Right.
But what are you going to do with that? Then once you have that, or like you said, when we are being diagnosed, even when we don't know, and I have a lot, I'm sure you do as well in the work that you do, I have a lot of patients, not a lot, a small minority that don't have official diagnosis. So especially in the autoimmune world. So it's just like we have a vague diagnosis of one thing, but we don't think that's related to the other symptoms. And they're just like, but I need to know what it is. I know something is wrong. It's like, but okay, I hear you. I hear something's wrong. How can we get you feeling better? Because let's focus on that. Let's focus on the healing. Let's focus on the gap and not the gain. Or that's the opposite. Let's focus on the gain and not the gap we have, and the things that are good, and how we can make what's going on better, how we can make ourselves feel better, rather than the lack and what's wrong. Because the more we focus on that, the more it grows. Focus on expands. And so focus on the good. And it's not, and I've heard other things, with CBT, at this point, it's all positive psychology, and we're not looking at the real world. And it's not, no, in order for me to exist in the real world, in order for me to keep going, in order to show up every day, I have to look at the good, because sometimes looking at only the bad stuff gets overwhelming and I get numb and paralyzed. So in order for me to keep forward momentum, we have to focus on good stuff. And so we can get more of it. We learn from the good stuff. We learn from bad stuff too, but we can get more of this in our lives.
Yeah, that's so true.
That is a big issue, the diagnosis and
and I think, totally. And what you said too, Dr. Brooks, about the aspect of, I don't know, just like there's two parts of it. Like you said, like you want to have that information, but it depends on the patient. Like sometimes if you have a patient who is, and if you're listening out there and you have a lot of anxiety, stay off of Google. Because when you're in that chronic disease, you're going to look so much, and stay off of groups where they're all about that disease that you've been diagnosed, because one, they're going to feed, like you said, they're going to feed the fear of ever getting better. And they're going to give you information that is not helping you. So a lot of times, I mean, it can be good, but something that's more general. I find that patients that are in a more general support group where they can relate will have more of or set some ground rules. Like in my healing groups that I have, I like, okay, these are the ground rules that we're going to be able to talk about to help support the other person in their healing process. But let's, not go down the road of, like you said, negativity and the fear. And because it doesn't help, it just drives us into that state of more ill health, for sure.
For sure. And like you said, there is something to be said for support groups and even
Right.
the bad stuff, knowing kind of that it's coming, but then just perseverating on that does not help it. It just makes
Right.
it worse because you now any little pop up of that, any little instance of negativity or bad feelings, you really dig into that. We
Right.
know like people with anxiety, with SSRIs and other drugs, they tend to have more side effects because they
Right.
are always listening to their body. So
Yep.
any warning, you're going to be on high alert. And so if you've already gotten all the information and all of that, again, that is what your world is and that's what you're focusing on, and you'll get more.
It's like more highly triggered, right? So if you're
More,
that type of
yeah.
person, you want to,
Yeah.
you know, surround yourself with things that are going to help you with your healing,
Yeah.
like the support that you're saying. So let's talk about that as we're wrapping up today. And what are ways that if you're looking for, let's say for instance, you don't feel supported in your family with your current state of health, what are some ways listeners can find that support? Because I think, you know, that a lot of times, like, I just don't feel supported. I feel like I have no help. I feel lost. And I think those are common things when people are in that chronic disease state.
I hear you. I totally agree. That's a really great question. The internet is a gift and a curse, right? So one, finding community helps. So podcasts like yours, right? Finding community, finding professionals is always a great place to start. I'm definitely not a fan of Dr. Google. I do that. The internet has brought us close together, but there's lots of misinformation and all sorts of things. But it is if you don't find that anybody that's doing what you're doing or that understands you or that is on the same path as you, the internet makes it very easy. It makes it allows you a window or access to people who are. And so you can find Facebook support groups, or again, I love podcasts. I love especially podcasts from experts because you can binge on it and pick their brain, books as well. But what you mentioned with the new diagnosis, you don't want to make it your identity. You want to make the desired goal your identity. So if your goal is a healthy person and someone who is pain-free and that has mobility, then you want to focus on those things and people who are doing those things so you can see what their habits are and what they're doing to support a life like that without injury and pain and other things. So make who you want to be your identity. And that's with joining groups with that identity, challenges, other accountability partners, often sometimes investing, honestly. And I hate to separate people from their money. That's not what I'm trying to do. But sometimes monetary investment in something or a time investment in something, we are more committed to it. So you know, investing in those things that we want to do and want to see. I would try to find a mentor of what you're doing. If that's, again, of better health, find someone who has overcome an autoimmune disease or that's living with it and model yourself after them. You want to model yourself after the people that are doing and looking like what you want to look like rather than the opposite, finding the people who are not having the life that you want. Because if you do what they do, you may get the results that they're getting because that's what they're getting. Modeling yourself after other people who are getting the results that you want and getting community with that and accountability. I think of other tips for that. That's it.
No, that's great. Yeah. And I think it's so true. And I like Instagram myself for that because you can find, say if you're suffering from Hashimoto's and you're looking for someone that is doing really great with it, has created recipes and all types of things. So I think that is a really fun way because you could follow people that are surviving and thriving, you know, and you're like, oh yeah, look at this person. This is what just a label. I can just be just like them, you know? And so I think that's like super important. I like that point that you made there. It was really key. Okay, Dr. Brooks, as we're wrapping up today, I have a couple more things. I have one more question, and then we'll talk about how people can find you and your awesome app. So let's talk about if you had an unlimited budget, what would you do to make the biggest impact right now in the health of the planet?
Oh, that's a really good one. Probably somehow with a plant-based diet, right? Like plant-based diet and exercise, honestly, help global warming and it would make people healthier as a physician.
No, that's a great answer. Yeah.
You know, so I would make a whole food plant-based diet accessible for everyone. And
that's a great one. Yeah. And it's important because that, like you said, when we eat a plant-based diet, it helps us with our own body. And then, like you said, it also helps the planet. So it's like twofold win-win. Right. Exactly. I love that. That's great. Okay. Let's talk about how people can find you and tell us about your cool habit app.
Sure. So the habit app is actually in the making. I'm getting an MVP out soon, hopefully in the next month or so. But again, I'm obsessed with habits. So I'm developing a gamified habit tracker app so that playing games helps you do the same habits that you want to do. So checking in. And so then our brain, we like routine, but we also like winning, and we like a good job. So getting coins and then rewards for doing the things that we already do every day. I'm working on that. I developed it for my patients because, again, they would come in with a chronic disease and we wanted to get to a result. And so we've been doing stuff on paper and tracking that way. But I know my mind, I love gamified apps. I get addicted to them. And so I want to create this for my patients.
Awesome.
So
I
I'm
love
doing
that.
that.
We'll put that for sure. We'll put that link in the show notes so that everybody can check it out. It's awesome. What's the name of it again?
Habitly.
Habitly. That's right. I knew it had Habitly. That's cute. I love that. Okay.
Thank
And
you.
then how can people find you? Website? What's the best way? I know you're a lot on TikTok. So what's the best way that people that can find you and follow you?
So I have not a lot. At this point, I probably have 100 TikTok videos, but I'm a baby TikToker. So I'm on TikTok. I believe I'm there as Dr. Katrice Brooks _MD.
Right. That's right.
On all my social handles, if you type in Katrice Brooks, my first and last name, you should be able to find me across the board. They're not all the same. I'm working on that. That's like a social media thing that we should do. But it's either Dr. Katrice Brooks, Dr. Katrice Brooks MD, Katrice Brooks MD on the various handles. But if you type in my first name, which is very unique, Katrice Brooks, those together, you should find me wherever I am. If you have any specific questions, you are definitely welcome to email me at hello@katricebrooksmd.com. My website is www.quench.clinic. That is for my direct primary care clinic, but I have links to my habit tracker app in there, the videos that I've done for YouTube and Facebook Live, etc. So I'm trying to populate the little world with my social media stuff. I'm out here.
That's great, Dr. Brooks. I love that. And we'll put all those in the show notes so everybody can find you, follow you, and just check out all the amazing things that you're doing. And thanks again today for joining us. I learned so much about health and how to create better habits and support ourselves in our journey through health. Thanks again.
Thank you so much. This was actually so much fun. Thank you for having me.
You're welcome.
For a while. Thank you.